to see this opiate stuff going on, it's just heart-wrenching. And it doesn't discriminate. It doesn't care who you are, if you have money, if you're poor, if you're middle income. It doesn't care what color you are. It's destroying lives in this country. And that's why we've been out front on a lot of issues, suing the manufacturers, going after the distributors, and really trying to make a difference in the community how doctors prescribe drugs. Because how many have kids? Right? And unfortunately, what's the worst thing we hate? When they get injured. They get a twisted knee or ankle playing sports or just walking down the street, and they go, "Doc, I'm in pain." And what's the first thing they do? "Well, let me give you some pain medicine." Whether it's yourself and you go in there, they automatically are ready to give you a 30-day supply. We have to change the way we look at it. We hate, and I'm not saying, I had someone who had chronic pain. I go, "Look, we're not trying to stop you from getting your medicine with chronic pain." But 1 in 4 people, the first times they use prescription drugs, they get addicted. And then it goes on to heroin. And that leads us why we're here today. This training that you're going to receive is really going to help you make a difference in someone's life. So I hope you never have to use it, truly. I hope you don't. But if you have to, you'll be able to do that. Just this morning on exit 5A, the ambulance was called for someone that had to use NARCAN for a reversal at exit 5A this morning. It's here in our community, people. And the fact that you're out on the street all the time, the fact that you're meeting probationary people, not just here, but you're out in the community, and especially you can carry this now when you go home at night and on weekends, you may be able to make a difference in someone's life. Stanford University study estimate wider available of NARCAN could prevent as many as 21,000 deaths over the next decade. And if you look at Albany County, in 2016, we had 28 deaths. In 2017, we had 39. We're steadily going up. We want to go down. We don't want to have one death. One of the things when we talked about the lawsuit, and I said there's no amount of money that we can settle on that's worth one life that we lost. Because how do you put a dollar value on someone's life? How do you put a dollar value on someone's recovery? You can't. And also, it's led into other problems with foster care. We are here to announce with a partnership from the state of New York that's providing all the kits, and we're doing the training, and obviously we're giving you time here at work to come and do this training to make the difference in someone's life. And Bill was just showing me the difference in the treatment. Years ago you had to just take the needle, was it a little plunger, and both with a little needle, and you stick it. Now this one, you just 2 sprays up the nostril, and it works. So this is what we'll be handing out in all of our kits, the nostril spray. It's pretty simple, even though we got to get everyone trained and certified. I'll say to the media, even if you have it, just 2 squirts up your nostril is going to make the difference in someone's life. So I do want to turn it over to Bill now, but I do want to say to the workers, thank you for being dedicated, first and foremost, to your jobs and turning the lives of people's life here in Albany County. I appreciate it.
Thank you, everyone, for attending this important event here at the Probation Department. The Albany County Probation Department continually strives to improve the lives of persons we work with in many ways. And I also want to thank County Executive Daniel McCoy for his forward thinking, allowing the Probation Department to deliver many programs such as this. In November 2018, Albany County Probation was certified by the New York State Health Department to operate an opioid overdose prevention program. This was authorized under New York State public health law, which allows public safety agencies to train and use NARCAN. Albany County probation staff are routinely in Albany County communities visiting probationers and their families. For many probationers, their involvement in the criminal justice system was a result of substance abuse. Probation officers during the course of their work may encounter someone who has overdosed. We want to make sure and ensure probation officers have the training and necessary Naloxone to make a difference when it matters most. The goal is for all probation staff to become trained and authorized to carry and use NARCAN in the course of their duties. NARCAN does one thing. It saves lives by reversing the effects of an opioid overdose. Thank you.